This week I had the opportunity to go to a 40-hour crisis intervention training here at the Tacoma Convention Center. The purpose of this training was to connect us with mental health professionals, law enforcement experts, and some of the providers in the area to help us with people in crisis, what resources we need and are available to us. What we're going to learn in most of these classes this week, and the goal of the majority of this training, is de-escalation and using it for us to have the best outcomes in any situation that we get into.
Today in the CIT training, I talked to the deputies about homeless outreach, because that's what I do, and how important it is for us to collaborate with local law enforcement as well as the community in getting people help. My hope in teaching this to the officers and deputies is that we can open awareness for the resources that are available and the help that's available to the people that are experiencing homelessness and need significant help or even just a little bit of help to get back on their feet.
So the block I just finished teaching was a block on the Involuntary Treatment Act, which is a block that teaches deputies when they can take people into involuntary custody. So this is an important block because officers need to be aware of not only when they can legally take someone into an involuntary custody, but also when it's appropriate, and then also how to do it and how to use other resources to make sure it works effectively. How to work with our mental health responders and do it as a team.
So I did a segment on active listening skills. I hope to accomplish through teaching active listening is giving officers a resource and a tool to be able to use when they're dealing with someone in crisis.
More and more we're dealing with persons in mental health crisis. We are not mental health professionals. We're not trained in that area well enough to be that. But we have to have at least a baseline training to initiate the conversations with them, to initiate the meeting with them, and then get them the right resources and get them the actual professional help that they need.
Now that we've gotten to learn some new skills in the classroom, it's time for us to go and do some practical exercises to show what we learned.
I hear her screaming stuff once in a while, and she seems to be hiding behind that post, and so I just thought maybe there was something going on. So
have you ever seen her before out here?
No.
Okay.
So we're here to help.
It's not safe there.
We're here to help.
How are you going to help? Do you have guns?
Of course.
Can you call air support?
We can call whoever we need to come out here. You know, right now we're not. I believe what you're saying, but we're not hearing or seeing the same things that you are. Okay. So I just want to make sure that we can have you talk to somebody.
Whenever you get somebody acting like this, there's a good chance they're either off their medication or they put something on top of their medication that they shouldn't, and it's creating this reaction.
I feel like it's very important for officers to go through this 40-hour crisis intervention training. Part of the training provided a lot of community resources, and building those relationships with our community partners is very important, as well as having those resources.
I think the CIT training is very valuable for officers and deputies. I believe that it brings awareness. A lot of times they don't know that teams like mine exist or that services are available in certain areas. I also think that bringing the community together with law enforcement, human services, and other agencies, as well as citizens and all of the people that live here in Pierce County, it's important to bring us all together because at the end of the day, we have the same destination. Sometimes there's just different ways to get there.